Autoimmune diseases are conditions where the immune system mistakenly attacks the body's own tissues. These disorders can affect almost any part of the body, leading to a wide range of symptoms and complications. Today, we'll explore some of the most common and notable autoimmune diseases, helping you understand what they are, how they manifest, and why early recognition is important. Whether you or someone you know is affected or you're simply curious, this overview will provide valuable insights into these complex conditions. Let's begin our journey by understanding what makes autoimmune diseases unique and why they matter. Autoimmunity occurs when the body's immune system, which normally protects against harmful invaders like bacteria and viruses, turns against its own cells. This self-attack can cause inflammation, pain, and damage to various organs and tissues. The exact cause of autoimmunity isn't fully understood, but it's believed to involve a combination of genetic, environmental, and hormonal factors. Understanding autoimmunity is the first step in recognizing how these diseases develop and why they can be so challenging to diagnose and treat. Rheumatoid arthritis is one of the most well-known autoimmune diseases. It primarily affects the joints, causing pain, swelling, and stiffness, especially in the hands and feet. Over time, rheumatoid arthritis can lead to joint damage and loss of function. Unlike osteoarthritis, which is caused by wear and tear, rheumatoid arthritis is driven by the immune system attacking the lining of the joints. Early diagnosis and treatment are crucial to prevent long-term complications and maintain quality of life. Systemic lupus erythematosus, often simply called lupus, is a complex autoimmune disease that can affect many parts of the body, including the skin, joints, kidneys, and even the heart. Lupus symptoms can vary widely, from mild fatigue and joint pain to more severe organ involvement. A hallmark of lupus is the butterfly-shaped rash that appears across the cheeks and nose in some patients. Managing lupus often requires a team approach and careful monitoring. Type 1 diabetes is an autoimmune disease where the immune system destroys insulin-producing cells in the pancreas. This leads to high blood sugar levels and requires lifelong insulin therapy. Unlike type 2 diabetes, which is often related to lifestyle factors, type 1 is not preventable and usually develops in childhood or adolescence. Early symptoms include increased thirst, frequent urination, and unexplained weight loss. Proper management is essential to prevent complication. Multiple sclerosis, or MS, is a chronic autoimmune disease that targets the central nervous system, particularly the brain and spinal cord. The immune system attacks the protective covering of nerve fibers, leading to communication problems between the brain and the rest of the body. Symptoms can include numbness, weakness, vision problems, and difficulty with coordination. MS often progresses in unpredictable ways, making each person's experience unique. Hashimoto's thyroiditis is the most common cause of hypothyroidism, or underactive thyroid in many countries. In this condition, the immune system attacks the thyroid gland, leading to reduced hormone production. Symptoms can include fatigue, weight gain, cold intolerance, and depression. Hashimoto's is more common in women and often develops slowly over time. Treatment usually involves hormone replacement therapy to restore normal thyroid function. Graves' disease is another autoimmune disorder that affects the thyroid, but unlike Hashimoto's, it causes the gland to become overactive, resulting in hyperthyroidism. Symptoms may include weight loss, rapid heartbeat, anxiety, and bulging eyes. Graves' disease is also more common in women and can run in families. Treatment options include medications, radioactive iodine, or surgery to control thyroid hormone levels. Psoriasis is a chronic autoimmune skin condition that causes red, scaly patches, often on the elbows, knees, and scalp. Some people with psoriasis also develop psoriatic arthritis, which leads to joint pain and swelling. These conditions can significantly impact quality of life, but treatments are available to manage symptoms and reduce flare-ups. Early intervention can help prevent joint damage in psoriatic arthritis. Celiac disease is an autoimmune disorder triggered by gluten, a protein found in wheat, barley, and rye. When people with celiac disease eat gluten, their immune system attacks the lining of the small intestine, leading to digestive issues, nutrient deficiencies, and other symptoms. The only effective treatment is a strict gluten-free diet, which helps heal the intestine and prevent complications. Inflammatory bowel disease, or IBD, refers to two main conditions: Crohn's disease and ulcerative colitis. Both are autoimmune diseases that cause chronic inflammation of the digestive tract. Symptoms include abdominal pain, diarrhea, weight loss, and fatigue. IBD can be unpredictable, with periods of flare-ups and remission. Treatment focuses on reducing inflammation and managing symptoms to improve quality of life. Sjögren's syndrome is an autoimmune disease that primarily affects the glands that produce moisture, such as the salivary and tear glands. This leads to dry mouth, dry eyes, and sometimes difficulty swallowing. In some cases, Sjögren's can also affect other organs, including the kidneys and liver. Treatment aims to relieve symptoms and prevent complications, often involving artificial tears and saliva substitutes. Myasthenia gravis is a rare autoimmune disease that affects the communication between nerves and muscles, leading to muscle weakness and fatigue. Symptoms often worsen with activity and improve with rest. Common signs include drooping eyelids, double vision, and difficulty swallowing. While there's no cure, treatments can help manage symptoms and improve muscle strength. Pernicious anemia is an autoimmune condition where the body can't absorb enough vitamin B12 due to the immune system attacking cells in the stomach. This leads to anemia, fatigue, and neurological symptoms if left untreated. Vitamin B12 injections or supplements are the main treatment, helping restore normal blood levels and prevent complications. Autoimmune hepatitis is a disease where the immune system attacks the liver, causing inflammation and potentially leading to liver damage. Symptoms can range from mild fatigue to severe jaundice and liver failure if untreated. Early diagnosis and treatment with medications can help control inflammation and prevent long-term liver damage. Addison's disease is a rare autoimmune disorder where the immune system destroys the adrenal glands, leading to a shortage of essential hormones. Symptoms include fatigue, weight loss, low blood pressure, and skin darkening. Addison's disease requires lifelong hormone replacement therapy, and prompt treatment is vital during times of stress or illness. Vitiligo is an autoimmune skin disorder where the immune system destroys pigment-producing cells, resulting in white patches on the skin. While vitiligo isn't physically harmful, it can have a significant emotional and psychological impact. Treatments aim to restore skin color or even out skin tone, but results vary from person to person. Alopecia areata is an autoimmune disease that causes hair loss, usually in small, round patches on the scalp or other parts of the body. The immune system attacks hair follicles, leading to sudden hair loss. In some cases, hair may regrow on its own, while others may experience more extensive hair loss. Treatments can help stimulate regrowth and manage symptoms. Guillain-Barré syndrome is a rare autoimmune disorder where the immune system attacks the nerves, leading to muscle weakness, tingling, and sometimes paralysis. Symptoms often develop rapidly and can be life-threatening if breathing muscles are affected. Most people recover with prompt medical treatment, but some may experience lingering effects. Dermatomyositis is an autoimmune disease that causes muscle weakness and a distinctive skin rash. The rash often appears on the face, knuckles, or chest, and muscle weakness can make everyday activities difficult. This condition can also affect internal organs, so early diagnosis and treatment are important to prevent complications. Scleroderma is a group of autoimmune diseases that cause the skin and connective tissues to harden and tighten. In some cases, scleroderma can also affect internal organs such as the lungs, heart, and kidneys. Symptoms vary depending on the type and severity, but early treatment can help manage symptoms and prevent complications. Autoimmune encephalitis is a rare but serious condition where the immune system attacks the brain, causing inflammation. Symptoms can include confusion, memory loss, seizures, and behavioral changes. Early recognition and treatment are crucial to prevent long-term neurological damage and improve outcomes. Autoimmune uveitis is an inflammation of the middle layer of the eye caused by the immune system attacking eye tissues. Symptoms include eye pain, redness, blurred vision, and sensitivity to light. If left untreated, uveitis can lead to vision loss. Treatment usually involves corticosteroids and immunosuppressive medications. Autoimmune inner ear disease is a rare condition where the immune system attacks the inner ear, leading to hearing loss and balance problems. Symptoms can develop suddenly or gradually and may fluctuate over time. Early treatment with steroids or immunosuppressants can help preserve hearing and improve balance. Goodpasture syndrome is a rare autoimmune disease where the immune system attacks the lungs and kidneys. This can cause bleeding in the lungs and kidney failure if not treated promptly. Symptoms include coughing up blood, shortness of breath, and swelling. Early diagnosis and aggressive treatment are essential for the best outcomes. Pemphigus vulgaris is a rare autoimmune blistering disorder that affects the skin and mucous membranes. The immune system attacks proteins that hold skin cells together, causing painful blisters and sores. Treatment involves immunosuppressive drugs to control the disease and prevent complications. Bullous pemphigoid is another autoimmune blistering disease, usually affecting older adults. It causes large, fluid-filled blisters on the skin, often on the arms, legs, and abdomen. While it can be uncomfortable, bullous pemphigoid is generally less severe than pemphigus vulgaris and responds well to treatment. Autoimmune hemolytic anemia is a condition where the immune system destroys red blood cells, leading to anemia. Symptoms include fatigue, shortness of breath, and jaundice. Treatment may involve steroids, immunosuppressants, or blood transfusions depending on severity. Idiopathic thrombocytopenic purpura, or ITP, is an autoimmune disorder where the immune system destroys platelets which are needed for blood clotting. This can lead to easy bruising, bleeding, and petechiae, small red or purple spots on the skin. Treatments include steroids, immune globulin, or sometimes removal of the spleen. Autoimmune neutropenia is a rare disorder where the immune system attacks neutrophils, a type of white blood cell important for fighting infections. This increases the risk of infections, especially in children. Treatment may include medications to boost white blood cell production or suppress the immune response. Autoimmune lymphoproliferative syndrome is a rare genetic disorder where the immune system fails to regulate itself, leading to an overproduction of lymphocytes. This can cause enlarged lymph nodes, spleen, and liver, as well as autoimmune blood disorders. Treatment is tailored to each patient and may involve immunosuppressive therapy. Wegener's granulomatosis, now called granulomatosis with polyangiitis, is an autoimmune disease that causes inflammation of blood vessels, mainly in the nose, sinuses, lungs, and kidneys. Symptoms can include sinus pain, nosebleeds, cough, and kidney problems. Early diagnosis and immunosuppressive therapy are key to managing this condition. Behçet's disease is a rare autoimmune disorder that causes blood vessel inflammation throughout the body. Common symptoms include mouth and genital ulcers, eye inflammation, and skin lesions. The disease can also affect the joints, blood vessels, and digestive tract. Treatment focuses on reducing inflammation and preventing complications. Polymyositis is an autoimmune disease that causes inflammation and weakness in the muscles, especially those closest to the trunk of the body. Symptoms develop gradually and can make activities like climbing stairs or lifting objects difficult. Treatment includes medications to reduce inflammation and physical therapy to improve strength. Antiphospholipid syndrome is an autoimmune disorder that increases the risk of blood clots in veins and arteries. It can lead to complications such as deep vein thrombosis, stroke, or pregnancy loss. Treatment usually involves blood thinners to reduce the risk of clotting and careful monitoring. Autoimmune pancreatitis is a rare form of chronic pancreatitis caused by the immune system attacking the pancreas. Symptoms include abdominal pain, jaundice, and weight loss. The condition often responds well to steroid treatment, and early intervention can prevent complications. Primary biliary cholangitis is an autoimmune disease that slowly destroys the bile ducts in the liver. This leads to bile buildup, liver damage, and eventually cirrhosis if untreated. Symptoms include fatigue, itching, and jaundice. Early diagnosis and medication can slow disease progression and improve quality of life. Primary sclerosing cholangitis is another autoimmune disease affecting the bile ducts, causing inflammation and scarring. Over time, this can lead to liver failure and increased risk of bile duct cancer. Symptoms may include fatigue, itching, and jaundice. There's no cure, but treatments can help manage symptoms and complications. Autoimmune orchitis is a rare condition where the immune system attacks the testicles, causing pain, swelling, and sometimes infertility. It can occur on its own or as part of another autoimmune disease. Treatment focuses on reducing inflammation and preserving fertility when possible. Autoimmune oophorytis is a rare autoimmune disease where the immune system attacks the ovaries, leading to ovarian failure and infertility. Symptoms may include irregular periods, hot flashes, and infertility. Treatment may involve hormone replacement therapy and fertility preservation strategies. Autoimmune polyglandular syndrome is a group of rare disorders where the immune system attacks multiple hormone-producing glands, such as the thyroid, adrenal, and pancreas. This can lead to a combination of symptoms from different endocrine diseases. Treatment involves replacing deficient hormones and managing each condition individually. Autoimmune gastritis is a chronic inflammation of the stomach lining caused by the immune system attacking stomach cells. This can lead to vitamin B12 deficiency, anemia, and increased risk of stomach cancer. Treatment focuses on managing symptoms and preventing complications with vitamin supplements and regular monitoring. Autoimmune hypophysitis is a rare condition where the immune system attacks the pituitary gland, leading to hormone deficiencies. Symptoms depend on which hormones are affected and may include fatigue, headaches, and vision problems. Treatment involves hormone replacement and sometimes immunosuppressive therapy. Autoimmune retinopathy is a rare disease where the immune system attacks the retina, the light-sensitive tissue at the back of the eye. This can lead to vision loss, night blindness, and visual field defects. Early diagnosis and immunosuppressive therapy can help slow progression and preserve vision. Autoimmune diseases are a diverse group of disorders that can affect nearly every organ system in the body. While some are common and well-known, others are rare and challenging to diagnose. Early recognition, accurate diagnosis, and appropriate treatment are key to managing these conditions and improving quality of life. Ongoing research continues to shed light on the causes and best treatments for autoimmune diseases, offering hope for better outcomes in the future. Staying informed and working closely with healthcare providers can make a significant difference for those affected.